I'm gonna provide an update with where we are and kind of what's going on across the state and then as well locally. But I wanted to start by specifically thanking the five of you, the county commissioners, for your support throughout this process. We have gotten 100% buy-in, commitment, and investment from you as local community leaders, as well as from our mayor. You couldn't possibly understand how much it means to us to have both your support publicly as well as privately during this. And we would not be able to do this job and ask our citizens to do what we're asking them to do without you all having our backs as well as the mayor. So I want to thank you guys specifically. Much of the data I'm going to present today is going to be driven out of our own office of data and analytics and from our local public health department. And I'm going to say this because I know Susan never would, but our director Wheelan never would, is that when she took over about 6 months ago, one of the first things she wanted to do was reach out to other county offices and develop a central hub of data and analytics so that no matter what we faced in the future, we would have people in place who could provide on the ground up-to-date information that would help us and you all drive our decision making. And that was completely her vision. And this was a lesson learned from how we struggled initially to deal with our teen suicide epidemic. And so we took those lessons and she applied it to this situation. And so without that vision, without her efforts, we would not be able to present what we're here presenting today. So with that, let's get started. Am I driving? Looks like I am. So we're gonna begin a little bit with a history lesson. And I think in situations where we have crisis and big challenges ahead, it's helpful to look back and see where we've been and how we've overcome similar challenges. And really the only thing that we have in our nation's history of a similar magnitude dealing with public health is really the Spanish flu epidemic of 1918. And so many of you may know this story, and obviously many of us are learning it now because it's very applicable to where we are today. But the first U.S. case occurred on a Kansas military base in March of 1918. And the virus quickly spread around the world, including Europe, America, and eventually every single corner of the globe. It killed about 50 to 100 million folks globally and approximately about 500,000 Americans. And what we learned from the Spanish flu epidemic was various communities took very different approaches to how they handled it with very, very different outcomes. And we've had 100 years to learn the lessons of Spanish flu. And so those lessons are what we're applying currently. And this is a report that came out, a couple of studies came out in 2007 that looked back at the Spanish flu and how local public health departments and the country in general dealt with it. And they, on that retrospective review, found that, by comparing the fatality rates in various communities, the timing of intervention, and what those interventions look like, there was a difference between about 50% decrease in fatalities in some communities over others. And that they felt that the most effective efforts that were taken in the communities that saw decreases in their fatalities were early and simultaneous closing of schools, churches, theaters, and banned public gatherings, and which allowed for increased time to ramp up prevention efforts, to decrease strain on the public health department, and to ultimately look for vaccines, which I think we have all had that conversation about 10,000 times in the last few weeks about what we are doing and why. And so here's a look at, and this is from National Geographic, but this is a look at various communities around the country. And the ones at the top are the ones that have the highest fatality rates. And those were communities that waited on prevention efforts, and when they did them, that they did not commit fully to them. Or if they did commit, they withdrew those efforts earlier than they should. And Philadelphia is kind of the classic example. Of about 10 days after they had their first death, they decided to hold a parade for 200,000 people, and which resulted in massive spread of the influenza virus and the largest fatality peak in the country. The communities at the bottom of the chart there our communities that had their prevention efforts start out very, very early, and they continued with those for great periods of time, and it dramatically affected the overall peak of not only the number of fatalities, but how many of those folks were getting sick at one time. And in 100 years, when we look back on how we did, obviously we want to be one of those communities that's at the bottom there. And so that brings me to a point, and that's that several points actually, and that's that number one, we're not doing anything, and we're not asking our community to do anything that we haven't done before in this country. Secondly, everything that we're asking our community to do and for you to support us in, we have done before, and it's worked before, and we know it has. And then I think when we look back, we can gather a lot of insight and inspiration that we have persevered through similar things before, and we will once again persevere and thrive. And so I want to thank you all for committing with us to what we're trying to do. The reality is not everybody is on board with what we're trying to do, and we know that. And while I very much look forward to someday sharing a beer with some of my friends and colleagues at one of our fine local establishments to debate the difference between and the various weighing of liberty and First Amendment rights versus public safety. I love a good political debate as much as anybody else. Now is probably not necessarily the time to have that conversation when public health is attempting to get folks to the lifeboat, the folks who aren't on board, and I'm not talking to anyone in this room certainly, and leadership in this community. You're welcome to continue rearranging the deck chairs, but we would much prefer if you got on board with us and helped us. And so I know that's not an easy decision to make locally for some leaders of businesses in the community, but we need your help. So thanks you all for giving that to us. So now we're going to move on and figure out how we're going to get out of this mess, to be honest with you. And so one of the advantages that we have as Americans, we have a lot of advantages, but one of the big advantages we have in this particular case is that we're a little late to the dance here, which is a good thing. It's unfortunately not a dance that anybody wants to be at, but we have the opportunity of seeing how other countries have handled this and what has worked and what hasn't worked. And I'm going to give a few examples of those to help reinforce some of what we're doing. And so South Korea was a good example of a country that was doing really well early on. Essentially, over the first month of their COVID cases, they had used very aggressive quarantining and containment strategies. They were identifying people immediately who were sick. They were isolating them, and they were quarantining those contacts. And that proved exceptionally effective, and that's the approach that we've been taking locally. Unfortunately, the 31st patient, so they had essentially 30 patients over the first month. The 31st patient was an individual who was symptomatic and attended a fairly large, robust church service at the Shincheonji Church of Jesus. And within 2 days of attending that service while symptomatic, 15 additional people became ill that were related to that contact with that first individual. And this is what spiraled kind of out of control for them. From that date for the following month, once again, the first month they contained it to 30 individuals. From the second month, beginning of the second month, for the next 30 days, the contagion spread, and that church surrounding area became really the epicenter of their outbreak, to the point where 1 month later they had over 9,000 cases, and more than half of them were related specifically to this church. And so we can see that even with our best efforts, all it really takes is one person. It takes one event that someone who's sick at or is contagious to go to, which can result in massive, quick spread of that virus that will in large part derail all the successes that you've had up to that point. And this is another graphic showing that first month from January 20th to February 20th, the relatively controlled spread of that, and then the church cluster begins, and you can see the massive growth and the quick exponential spread of the virus, of which the vast majority were responsible for that one individual. This is an experimental model that kind of looks at the various approaches to how to deal with this, because there's not necessarily one answer. And so what this is a computer model where they take one dot that's infected, and they send that dot around kind of like an old Pong game where it kind of bounces around, hits on other balls. It bounces around. When it touches another ball, it infects that ball, and then that ball can then go and spread and infect the other balls around it. And so they put various metrics or controls on it. And the first one on the far left, you can see the axis that goes up is the positive cases, and then the axis that goes across the bottom is time. And you can see if you do nothing, you just say, hey, let's let her rip. Let's see what happens. You can see massive spread, super high peak. That's the orange are the infected. The purple are the people who have recovered. And so in this particular example, 100% of the people are going to recover. It's obviously not the case for us. You can see that's not an ideal situation. That would crash the healthcare system of any country, of any community in the world. And so the next option is they look over, like, okay, well, let's quarantine. Let's take the group that we know has an infection, and let's try to separate that group out from the rest of us. And that's what people do when we say, well, let's close a border, or let's quarantine a state or a region. Let's say we decided, hey, Denver's got more cases than us. Let's close the border between us and Denver. That'll help keep it out. And that will work for a little bit. Obviously, the community that's affected will continue to grow. But eventually, we all know this thing gets through, and it has to nearly every major country in the world. And so if you do nothing on the back end in the community that the spread is coming to, you just let that be the free-for-all, you get this. You get two peaks, one initially with the first population, and then the other one even higher with the population that you try to quarantine away from the infected one. And so once again, that's not an effective way to do this, because the virus will ultimately find its way into your community. And so now we move on to the third one, which is what we call moderate social distancing or physical distancing, which is what we deployed initially here in our community. And this, what you do is you say, well, half the balls aren't allowed to move. They got to stay where they are. Some of them have to move, right? We have critical infrastructure, critical employees that have to get around. Our healthcare workers are going to continue to operate. And with that, you drastically lower the peak. You lower the rate, and you spread out those diseases over time. And you can see the purple is the number of people who never become infected. They're never infected by the virus. And so you're trying to maximize that group of individuals and spread that over time. And very effective. It works well. You can still see a little bit of a peak, which takes us to the last one, which is extensive social distancing. And that's really the kind of the place that we are now, as well as other countries that have taken even more extreme measures than what we have. And that's really the most effective way. But as we've talked before, you're always balancing, that critical infrastructure and allowing the economy to at least continue to function and minimize our losses while maximizing what we're doing with social distancing. And so that's really where we are now, and that's the approach that we're taking. And we'll talk a little bit more about how that's working.
Can I stop you for just 1 second? Commissioner Gonzalez.
Thank you, Mr. Chair. So my question on the other slide, so are the areas under the curve the same, cumulative? Essentially, basically, would we still have the same amount of people ill at the end of any of the three cases?
Yeah, so as you move from left to right, you do decrease the total number of people that ever become infected. So that's the one big benefit. The second benefit is those that do become infected are spread out over time. And so no matter what approach you're going to use, I think to your point, you're going to have a large portion of your population who is ultimately going to become infected. There's nothing that we're probably going to be able to do to stop that from happening. The biggest thing is how far can you spread it out, and how many people can you ultimately prevent from getting it, because that percentage, that math game that you're playing is what's going to drive your ability to weather that peak, the folks that are coming in that require it. Good question. Okay, so now we're going to move on. This is data as of last night, and as you can obviously understand, this is going to change day by day, and so we're reporting these numbers out usually in the evening between 5 and 6 o'clock. So El Paso County, we have 245 confirmed cases as of last night. 11 of those have died. And I'm going to talk quite a bit about our deaths here, because I think we need to put those deaths into context of what's happening in our community and what's not happening in our community. In Colorado, we got about 2,600 cases, 51 total deaths. In America, 260,000 cases, approaching 3,000 deaths, and we are rapidly accelerating in the number of deaths that are being reported across the country, specifically in relationship to what's happening in New York and New Jersey and a few other places, and we'll talk about that. And then globally, 777,000, about 37,000 deaths. To put this in perspective, early on there was a lot of discussion about, well, hey, we had H1N1, a lot of people died, that was super scary, but you guys didn't do this. Like, you guys are going crazy overboard. Well, we've got 3,000 dead Americans. In all of the H1N1 over a 2-year span, we lost 12,000 Americans. And so in essentially a month, we are well on our way towards eclipsing those totals, and probably will within the next few weeks. And so as we've been saying from the beginning, this is not the seasonal flu. This is not H1N1. This is something in many ways different, and we are seeing the effects of that.
Before you move on,
Yeah.
one of the things I heard the governor say yesterday was that what we're doing is having an impact. I won't say it's working, because I don't know that we can say anything absolutely works here, but he says it's having an impact. We were, before we started the shelter-in-place or stay-at-home orders or mandating social distancing, we were doubling at a rate of, in terms of number of cases, we were doubling at a rate every 2 days. And now it's more like doubling at a rate of every 5 days. Are we seeing those same sort of trends in El Paso County? Is that an indication to you as the healthcare professionals that this is having a positive impact on how we proceed moving forward? And is there any sort of indication of what this is going to look like out in the future based on those numbers?
Yeah, and that's exactly what we're about to get into. So those are the big questions. And I think
I knew you were going to get into those. That's why I asked the question ahead of time. Making myself look smart. So
So we're going to take exactly a look at that, and I think I do have good news.
Okay.
We don't get a lot of good news in this thing, but I think today I can offer some. Yeah.
Commissioner Vanderwerf.
Yes, thank you, Mr. Chair, and thank you, Doctor, for being here. Look forward to the rest of your conversation. One of the things that was very concerning to me early on was some of the reporting that had been going on at the national level, stating things like 1.6 million to 2.2 million deaths, and then conveniently failing to mention that that was the kinds of numbers that were modeled if there was no response to the virus, and that responses can be modeled, and you did some of that, and I'm very grateful that you're doing that and showing that, because it helps provide confidence that these models can deliver answers and also responses by modeling them and getting an understanding about what that response can or cannot do. And so when you do extensive numbers of responses, as we are doing today, we're going to be nowhere near those kinds of numbers that were initially reported. I thought that there was a disservice done because some reporting agencies, some companies that do news were failing to mention that 1.6 million to 2.2 million number was if we did nothing at all. But these responses knock these numbers way down, and I think the kinds of responses we're doing are going to just massively reduce those numbers of deaths, and you're talking about some of those right now. So I just thought it was important to make that point, that those kinds of numbers we're never going to get to those numbers because we're responding.
That's right. Yeah, and early on with any modeling or any statistics, the earlier you start doing that, there's a lot of variability because you don't have enough data points to look at. And as we're going through this, our data analytics people are adding these data points in every single day. And as we get out further, we get better at figuring out how we're doing and then where we're going. And we'll continue to update this board with that information. But I think it does two things. One, it helps inform the decisions that we're making. But the other thing that it does, it helps reinforce that what we're doing is working. All right, because this isn't about panic. This isn't about terrifying people. This is about giving the citizens the accurate, true information so they can say, yeah, I see it. I got it. I'm on board with this. Let's keep doing it. And that's what our responsibility is as community leaders. It isn't to tell people what to do. It's to show them why this is the right thing to do and lead them to those decisions and then help reinforce that, positively on our community. And that's one of the things that we have drawn criticism at Public Health is well, why aren't you out there, knocking on these doors and shutting these places down? And that's not what we do. What we do is help people make good decisions with their lives by giving them accurate information. And so we're here not to say, hey, the governor said to do this, the president said to do this, you need to do it. We do need to do it, but not because anybody told us, but because it's the right thing. And that's on us to prove that to folks. And so that's my goal, one of my goals here today, and you're exactly right. And so here, once we starting to get into some of the data, and this is several countries around the world, and we all know about Italy, and most of us know about Spain, and China obviously is where it started. China obviously had some struggles early on with understanding what they were dealing with, but to their credit, once they did understand, they put fairly aggressive measures in place, and China is the gray line there that you see kind of flattening out across. Places like Italy and Spain are doing exactly what we don't want to have happen, which is exponential rise of their number of deaths. And so you can see the blue line there that's circled is the United States. And unfortunately, we currently are following a trajectory much more similar to Spain and Italy. But those numbers are being driven largely by New York State and New Jersey, who we have seen are struggling mightily with their local rates. And at one point, we're doubling every other day their number of cases. And so we have a very large country, and it's very diverse, and as I showed early on, this is in many ways community-driven. Decisions that are made locally and buy-in locally are going to ultimately drive. And so while this graph does highlight the challenges that we have totally as a country, I think our local efforts and how much commitment our community has to this, which I understand has been recently brought into question, I think is going to be reinforced by what's actually happening, what the data that we actually have. And I'll get into that a little bit later. All right, so here's Colorado, and you can see New York is the red one there at the top, and they are struggling, as I said, mightily, as well as New Jersey. Those two states are sort of taking off kind of on their own. And then there's a large cluster of states there at the bottom, which includes Colorado, which is in orange, that are taking that much more flattening approach to what we're doing. And so I think some of these states that are kind of their own cohort hopefully will continue to follow each other, and that line will continue to stay flat and ease out. You'll notice there Colorado's orange, but El Paso County specifically, this is cases per 100,000. That's important to know because when people start talking about, well, you have this many deaths. Well, yeah, we're the biggest county in the state. And so if the rates are equal all the way across the board, we should be leading in the number of deaths. That's not a statistical surprise, right? And so we need to make sure when we're talking numbers accurately, and we're not using them in a way that's statistically inappropriate that makes it look like we're not doing a good job when in fact we are, and I'll talk more about that. But you'll see that El Paso County is actually below the Colorado average. And so as far as cases per 100,000, we are having success here locally, and as I'll mention several times, we are very proud of the efforts our local community has made. This is the top 10 U.S. counties case fatality rate. So this is your number of fatalities divided by the number of positive cases that you have, and this is what's being largely reported as El Paso County is struggling with their fatalities, and you can see we are in the top 10 of this rate. And our fatality rate, case fatality rate, is about 5% right now, and I'll talk about why that is, and certainly why that isn't. These numbers are going to change dramatically from day to day, and some of the ones that are notable are the King, Washington, which had an outbreak initially at a nursing home, which resulted in numerous fatalities, which really highlights the critical component of keeping that virus out of long-term and assisted living facilities. And then Weld County also is kind of right there in the same boat with us as far as Colorado counties.
Yes, Commissioner Williams.
Yeah.
Mr. Chairman. So my question on this would be, and I'm assuming you're going to address it, is I don't think that we are actively testing people, so they're presumed positive if they have symptoms, and so I'm wondering if that's why our rates are higher. And I'm assuming.
And that's a great point. When you talk about case fatality rate, there's two numbers there. The first is how many people have died. And then the second number is how many total positive cases you have. If you aren't testing everybody, there's going to be cases that you're not going to know are positive. And because of our testing shortages in Colorado, we have pushed those tests only to the people that most specifically need it. If you oversaturated our community with testing, you would find more people. That number would lower that overall case fatality rate. So there's a lot, especially when we're this early in this thing, there's a lot of data issues that public health has no control over, that our community members have no control over, that are going to affect that, right? And so that's an important point to make, is that we all want to look at numbers and then compare and see how everybody's doing, but every community is not the same. Every community's access to testing isn't the same. Every community's recommendations, and that's what Colorado's current recommendations are, that we save those tests for the people that really need it. Now, generally, most of the country is falling under these same issues, these same challenges with testing, so there is some equilibration of that issue, but that's an important point to make, and you're exactly right. And so what is public health doing? All right, as the case becomes known, we have someone...
Just hang on one sec, just getting some notifications online here. If you're on the phone and you're obviously not speaking right now, please mute your phones. I guess there's a bunch of feedback going on for a number of the folks that are on the phone. So if you're on the phone, please mute your phone until it's your turn to speak. All right, sorry about that.
So, as the case becomes known to us, it's reported to our local public health department, typically through Colorado Department of Public Health or our reflexive systems. We are notified of that person. We then begin that investigation. We reach out to that individual. We find out, where they worked, where they've been, what contact that they've had with other folks, to identify other people at risk. And in some cases, they've been sick and home and with their family, and it's a couple of people. In other cases, like some of the ones I'm going to talk about, it may be more than 100 or 150 people that they've had contact with that we have to reach out to. On average, every single positive case is typically about 10 contacts that need to be notified and worked up by our team of epidemiologists. Those individuals are counseled on quarantine or isolation, in some cases provided letters to help support that. And then we continue to work those out. So if one individual is positive and we contact their contacts and one of those people is sick, then we have to reach out to that person's contacts. If one of those people is sick, then we just continue to branch out that way. I think it's important to note that this is the ideal way that you deal with an infectious disease. This is what we want to do in a perfect world, is aggressively identify these individuals, have rapid testing, identify their contacts, have rapid testing for them if they're symptomatic, and build that rim of protection around them. But the reality of the world that we live in is that there are numerous cases, some of which are very large. In many communities in Colorado, their public health departments no longer have the capacity to do this. And we have had conversations internally with our epidemiologists about, have we passed the point at which we can effectively do this? And our local epidemiologists have unanimously said, no, let's keep doing this. This is the best way to fight this. The challenge with that is this is incredibly labor and time intensive to do it this way. While it's the gold standard, it's very, very hard to do, which means that most of these folks are working, 12, 14-hour days, sometimes 7 days a week, tracking all these things down. And you don't schedule them. They're kind of like babies. They come when they come. And if that means they come late at night on a Friday or a Sunday night, you just keep working it until you get it done. And so what I want to do is reassure the community that we are continuing to do this. We are continuing to make outreach to those folks who may be affected. We've had several high-profile outbreaks recently, including King Soopers just yesterday or the day before. And so we are working through these absolutely as fast as possible, but it's critical that we have accurate information before we take action. And that we have a plan for what we're going to do. So there's always going to be a brief amount of time between when we're contacted and when we can properly work these up, but we are doing it as fast as we can, and we will continue to do that. There may be a point in the future where we're not capable of doing that, but right now we are. Where we're focusing and prioritizing those investigations are particularly our at-risk groups. And so, and we'll talk about the bridge tournament here in a minute, but also our long-term care facilities. If you're a young, healthy person and you've had minimal contact, we're going to work that up, but we're not going to need to spend a lot of time on you because you're in good shape and the folks you've contacted are in good shape. But our long-term care facilities, our assisted living, and our other social events that we've had that involve at-risk folks, particularly the elderly, are the ones that we've spent a lot of energy and time and investment on. And then in addition to that, obviously, we're fielding calls from folks in the community. Hey, I don't feel good. I'm sick. This is where I was. What do you want me to do? And so in addition to our outreach, there's a lot coming in. So, we talk about at the end of this thing when our folks have saved the galaxy and they're handing out medals like at the end of the first Star Wars movie, these are the people that need to be first in line because they've done incredible work. All right, so now to kind of piggyback on what I've talked about, what is driving in large part our early high case fatality rate as well as our numbers is that our first really outbreak, our first cluster of cases was in an at-risk population, and I compare this thing to this isn't a marathon. This is a 12-round title bout, and at the opening bell of this thing, we got kind of punched in the mouth a little bit, to be honest with you. And so what we had was our first individual who died was an elderly person who was at a bridge tournament. And now what's important to note here is that our first patient, our first death, was someone who had not had a travel history, which means that this individual contracted the virus from another local person. All right, and so the person who died was not the person that brought this to our community. Someone else who was here was infected. We have not been able to identify that person. And so our first person that died is as much of a victim of this as any of the others. And so I wanted to make it clear that this is no one's fault in this situation. In fact, the reality is that this individual who died and their family who also had people who developed symptoms and became ill, even though they were dealing with the tragic loss of a loved one, their priority was working with our EpiOps folks to identify who she had had contact with, who they had had contact with. The day that she died and we finally got the test back positive, we began working immediately to identify all those people. That's when we found out that she had attended a bridge club over several days. Okay. We then worked with the bridge tournament operator, who was incredibly helpful, who immediately upon learning that the individual was sick, closed down all operations, opened up every bit of information they had so that we could identify all these people that were involved. They were immensely helpful and critical in our response. Throughout this, every single individual was cooperative and helpful and only concerned about protecting their fellow citizens. And so as we worked that up, we realized that about 150 people could have had contact with her at that bridge tournament during that period of time, which resulted in us having to set up a call center and have a press conference the following afternoon to alert the public of what's going on. We got all the names of the individuals from the bridge tournament. We then reached out to every single one of those folks who we could make contact with to see how they were doing, because now some period had time from when she obviously was at the bridge tournament and then had died. Through that investigation, we identified 10 to 15 additional people who had become ill or were symptomatic. We then had to track their contacts, which then allowed us to discover that one of those individuals went to a choir practice that involved more than 100 additional at-risk people. And so over the course of the first several days of this investigation, it became clear that we were working with a very large portion of at-risk people. And so as we continue to work that up, ultimately between those two events that kind of cascaded outward, radiated outward, there were over 300 contacts that had to be reached out to. The public health department doesn't have the capacity to do that on their own. And so one of the things that we actually did was, I am also the El Paso County coroner, and so I asked and then otherwise demanded my employees, although they gladly volunteered, to come in on that Sunday. I had about 12 investigators and admin and the other doctors at the office come in, and the EpiOps folks handed us a list, said call all these people, and we did, and that's how we identified the additional choir group that had also been affected. What's important to note, though, is that because of the efforts of this original woman's family, because of the efforts of the Bridge Club organizers, and because of the efforts of those who were in attendance and they were willing to share that information, there were untold lives that were undoubtedly saved because everyone across the line knew that this was important and were worried about helping other people versus themselves. All right? And so once again, there's no one to blame here. These people were both victims of this virus as well as heroes. And so I want to make those points clear because a lot of that has been lost, particularly in our local social media. Unfortunately, though, through this investigation, we had 3 additional lives that were lost, which brings our totals to 4. So 4 of our total 11 are related directly to the outcome of this original outbreak. That, in large part, is what's driving our local increase, our local high number of deaths. But I want to make another point very clear, is that when this bridge tournament took place, the only guidance or orders that were in place were cover your mouth, wash your hands and cover your mouth when you sneeze. No one at this event was denying governor's orders or recommendations by the president or anybody else. They were simply living their lives and doing what they were supposed to do. So we cannot look at people who were victims of this, who died, and then blame them for not following orders that were never in place. And I want to make that part clear as well. All right, so how do we do this? This is what spread looks like. Bad until we get folks who choose to make really, really good decisions now that we're aware of what's going on. Obviously, the earlier you make interventions, the earlier you decide to make some of these decisions, you stay home, you do the things that we're asking you to do, has massive ramifications downstream. So one of the things that public health has tried to do is communicate effectively to our community. And part of our community is kids and young adults and other folks. And so we've tried several different routes of reaching out to them. And so one of the things that we did was to develop some cartoons, informative cartoons similar to what, if you grew up in the 80s, like the Electric Company or something like that, or PBS Kids would have. But it also is applicable to adults. So I'm going to try and play this, but I don't know if it's going to work. Let's see. Hello, I'm Dr. Leon Kelly, Deputy Medical Officer for El Paso County Public Health. Let's talk about how you can help fight the COVID-19 pandemic. The new coronavirus mostly travels from person to person by droplets that leave the infected person's mouth and nose during sneezing, coughing, or even talking. These droplets contain the virus, and if they land on other people or objects, the next person may take the virus in through their mouth, nose, or eyes. If we don't act to stop it, a person sick with COVID-19 typically infects 2 to 3 other people. So you can see how if we don't slow the spread of the virus, one person infects 3, who then infect 9, who then infect 27, and things can get out of control pretty fast. Add to that, if a sick person goes to a crowded public place like a church service, sporting event, or party, they can infect many of their family, friends, and neighbors. That's where you come in. We have several simple and proven ways to prevent out-of-control spread of the virus. First, like always, if you're sick, stay home. A good idea even not during a pandemic. Second, even for those of us who do feel fine, we may be infectious but only have minor symptoms or just don't feel sick yet. It's best to stand at least 6 feet away from one another so that those infected droplets can't make it to the person next to us when we talk or cough. We call this social or physical distancing. And third, until we've got this virus thing under control, we must must avoid gatherings that cause simultaneous infection of many people. Under the wrong circumstances, we know it only takes one person to infect many. And while you may be young and healthy and likely to do okay with COVID-19, the person you infect may not. So remember, for every good choice we make, it's not just one person we save from infection. It's possibly thousands. All right, so we're continuing to produce those and push those out through our social media, and the county's been on board with that and helping us. And that's one of the areas that we can depend on you all as well to help spread those messages as we continue to deal with our local infections. And so this is from State Public Health Department, and this shows the outcomes that happen with social distancing. And we're obviously well past making these decisions now, but it does reinforce that the earlier you make those decisions and the better you are, the earlier the positive outcomes are that you get. Now here's another graphic that's showing number of cases, and so this is comparing us with other Colorado counties. Once again, your testing drives this a lot, but most Colorado counties are operating under the same guidelines that we are. So we are comparing apples to apples for the most part here. And despite being the most populous county, we are well below several other counties that are smaller in our total number of cases. So I think that speaks to the level of commitment that our community has. Secondly, the middle one is cases per 100,000. So this is our rate by population. You can see here we are doing very well compared to some of our other county neighbors and friends. And so I think once again speaks to the quality of the efforts that we've made and the progress. And then here's our fatality rate. So fatalities by the number of cases. And certainly we are near the top of the pack, but we've talked about why that is. And we will continue to watch this number. But despite, I think, having some early setbacks and challenges from the public health perspective, we're very happy with where we are. We are very pleased with the commitment that our community is making and continues to make. The folks who aren't on board with this, we will reach out to them, obviously, and continue to have those conversations to encourage compliance. But we want to get compliance through people, coming to the decision on their own, as opposed to more drastic, I think, measures that are infringing on people. And so here's another, I think, very illustrative example or explanation for why we're seeing what we're seeing. Because of our Bridge Club and as well as some long-term care facilities that we've had outbreaks in, Laurel Manor being the big one. Many of our cases are in older people. They're the folks that we all know are susceptible, that are our at-risk population. And you can see the majority of our deaths are in the 80-plus range. And we know how this virus affects people in that age range. And so we do not believe that our local number of deaths is being driven by failure on anybody's part here. It's just unfortunate that right out of the gate we've had it in our susceptible populations. Obviously, as you move down in age ranges, our hospitalizations are much lower, and we have not yet had a death in anyone below the age of 60. And so this is an important one as we go on and as testing expands and we have more younger people who are being detected. Those numbers will grow, and hopefully we'll continue to provide good care to those folks, and those fatality numbers, while undoubtedly they will grow, will make up a much less percentage of our total cases. And here's...
Can you go back to that slide for just one second? Thank you.
Yeah.
It looks like in the kind of the older demographics, from 50 and above, about a third of the cases end up in the hospital.
Yeah, and I have a chart coming up here pretty soon that it shows that in another way. But yeah, you're exactly right, and that's also driving our large percentage of hospitalizations for cases, which is very much different than Colorado in general, and it's for that reason you just said.
And is that kind of, do we see similar numbers across the rest of the state and in other states where a third of the patients in a certain age demographics end up in the hospital?
Yeah, when you get into the upper age demographics, our older folks are behaving the same as other communities' older folks. It's just that right out of the gate, the larger portion of our positive cases were in that group. So it's not that our older folks are doing worse, it's just that we have more of them that are infected than other proportionally to other communities. And here's of our folks over 60, 77% of them are hospitalized. The majority of our folks had their onset of symptoms between 310 and 320, which highlights that we're always 1 to 2 weeks behind on all this data because you get it. It takes 5 days for you to get symptomatic. It takes usually another week for you to get sick and end up in the hospital, and oftentimes another week or so for fatalities to occur. And so we're always playing this game where we're a couple weeks behind with what we're seeing with what the actual efforts are. And so we'll know in 2 weeks, how we're doing today. And this speaks to your question, Commissioner Waller, and this is Colorado cases and hospitalizations. And so the blue line is total number of cases. You can see Colorado going up there. You can see the number of hospitalized individuals is also going up, but not nearly at the same rate. But you can see about 5% there are hospitalized, and then, there's the total number of hospitalized is the orange, and then the gray is the percentage of hospitalized. And so across Colorado, we're about 15% of those with it are in the hospital. But then when you take another look at the next slide, this is El Paso County specifically, and you can see the blue and the orange are mirroring essentially what we saw Colorado across the board, and that was illustrated in some previous slides. But that's our hospitalization rate, and we're at about 25% right now, and that number's going to grow today when the newest numbers come out. And so it illustrates it's not necessarily how many people get it, it's who gets it. All right? And that's why much of our efforts moving forward have to be focused on those at-risk populations, because that's the group that's going to end up in the hospital, that's going to consume our resources, that are going to ultimately be at the risk of needing the most intensive care, and then ultimately also dying. And so once again, those numbers are not reflective of the quality of work that our hospitals or anybody else are doing, but rather reflective of the demographic makeup of our local cohort of our folks who were infected initially. And we've all seen this graph about 6,000 times in the last month, so I don't really need to go through it, but it does illustrate kind of what we're trying to do here. And this is what happens when you increase your social distancing or physical distancing. The results are going to be fairly reliable. We know that the more you push, the better the outcomes are. Once again, trying to balance those outcomes with what your community can tolerate. And there's a lot of talk about doubling time. It's come up here today. And obviously what you want is a bigger number for your doubling time. You want it to take more days for your cases or your deaths to go from 2 to 4 and from 4 to 8. Where you get into trouble is when that becomes exponential and it's going upwards as opposed to going down. And you can see there's our El Paso County right there. It's staying relatively flat. We had a little bump early on, but this was a reporting issue. We had a couple days where cases didn't get reported, then they got a bunch reported because of backlogs at the public health department for the lab. So we had a little bump there, but then everything is flattening out. We're doing quite well. I think where we are, this is one of those numbers we're going to continue to watch. I know some of the other governors report on their doubling times every day and let folks know how they're doing. You always want that number to be getting bigger, and that's what we're going to follow. And right now, like I said, we like the place that we're in. We're still in the acceleration phase of this. We haven't, I don't think, been far enough out to see the full effects of some of the measures that we've put in place. But overall, we've had some challenges, but I think we really like where we are, and we like what our efforts, and we just want to continue to encourage our community to buy in with what we're asking them to do as hard as it is. And so ongoing things, we're fighting this war on 50 different fronts constantly. And so we are in continuous talks and collaboration with our hospitals and our long-term care facilities, our homeless service providers. That was a big one to get up and running, and we think we've finally got all those puzzle pieces in place. We've had a couple incidences where we've had to kind of start over because agreements and things fell through, but within the next couple days, we believe we'll have that homeless isolation shelter up and running. Working daily with our law enforcement and criminal justice center. As of this very moment, we don't have any positive cases in the jail, which is absolutely crucial. We have had some law enforcement officers test positive, but the sheriff has bought in 100% and has worked diligently to help that with that. First responders, media, schools, and our emergency response structure and greater community. We are in constant contact with all of these people and helping them work through this. We provide engagement, education, and subject expertise not only to you all, but to the mayor and other folks. And then we are constantly collecting data and using that to drive our decisions and policy making. And then with that, I will open it up to questions. And we've got Dr. Johnson here as well. We've kind of split up duties. She takes a lot of the healthcare, and I take a lot of the government stuff. We are continuing to work with our folks in the community, our local businesses, similar to what we saw with the King Supers yesterday. They had the one positive case, and so we helped work with them, not only local but corporate, and with the state public health department in driving their decisions and how they were managing it. And we do not expect hopefully that case results in any additional cases, but this is going to continue to happen, right? At stores and businesses and agencies, and so we're always going to be there having those conversations with them. And so with that, any questions?
And we're just going to take questions from commissioners. Let's start off with Commissioner Vanderwerf.
Thank you, Mr. Chair. I think the presentation you just gave is outstanding. It's very helpful in allowing us and the public to better understand the virus and its characteristics and the epidemiology and the process going forward. I think that's fantastic. I think also it's fantastic that this helps us understand the response effectivity based on different kinds of responses. I think that's also really valuable. And I'll also make the point that I think that the modeling that you're looking at, putting the numbers for our community against that model and doing a comparative analysis of where we stand against some of these models that have been provided to us, maybe doing a little modeling ourselves, it's probably going to be helpful in understanding how what kind of process we're going to follow in the future to back out once public health and the state and the federal government starts, allowing us to get back to a normal economy. Because that'll be important, I think, for people to know. We might not know the exact time when that's going to happen, but because you understand the effectivity of different responses, we might be able to go to something like the stay-in-place order is removed, but we want to retain social distancing or something like this. I don't know if that's the right or the wrong answer, but I think using the model is going to allow us to figure out how we back out of this process. So I just want to say thank you for the presentation. It was really, really, really outstanding, and that's the kind of information we need to get out to the public. So thank you.
Thank you. And yeah, we are starting to have those conversations, not about when we're going to do this, but how we're going to do it when we come out of this thing. And so some of our federal policymakers and public health think tanks and things like that are starting to have that conversation about how ultimately we get out of this and what the right way to do so that we can do it effectively and without having rebounds, because as you saw in the one graph, some communities stopped and then it rebounded with the Spanish flu. And so yeah, we are having those conversations and developing those plans. And the better data we have as we start to release those restrictions strategically about where we do that, we'll be able to monitor. One of the things I think is important is what this does is it buys us time so that when we get to the place where we start to ease those restrictions, we have testing testing up and running that's immediate. We have our EpiOps folks up and running and able to put out those spot fires as opposed to blanketing across the community, because that's really what it's going to take. As we come out of this, we're going to have outbreaks. And the best way to do that is not at that point, if we have the infrastructure in place and the funding and the manpower, is to reach out to those individuals and get them isolated versus having everyone have to live under the current circumstances that we have. And that's another place that we'll need your support as we develop those plans. We're going to have strategic asks of, if we want to come out of this thing and we want it to be effective, here's the place where we're going to need to invest to make sure we can handle the consequences of easing off, because there will be, but we can manage those with appropriate staffing and things like that. So thank you.
Thank you. Commissioner Williams.
Just a couple things. So in the family history lesson of the day, I wasn't alive, my father certainly wasn't alive, but in small town Utah, 4 deaths in 1918 in one day, in one family.
Yeah.
So it was very, very contagious. We appreciate all the data. I've already had one request that we make that available maybe on our website, or if Christy could send it to all of us. Thank you. And I think that you have, you're definitely, Governor Cuomo has nothing on you. You did a great job. One of the interesting things I found out about the data, and I think it'll be interesting to watch and see what happens, is usually on Monday and Tuesday towards Wednesday, there is a spike. And I think that's because a lot of people have been shopping on Saturdays and Sundays. So I think this stay-at-home order is going to be very interesting to see if we can reduce that spike in new cases, because people are able to shop all 5 days of the week for what they need. So thank you.
I'll let Dr. Kelly or Dr. Johnson address your latter part, but I did want to say that we will make that presentation available on our website, as well as being proactive and getting it out to the media as we have done, trying to keep up that good communication. We do provide updates to the Joint Information Center, 1 p.m. daily, not on Sundays, but that does happen on Saturday. So we're trying to provide a lot of information, and as everyone knows, information can change by the hour or by the day, and so it is extremely important that we keep up and connected to accurate sources of data, and like this presentation being unfiltered, and really encouraging folks to watch it all the way through, because I think it is tremendous. It has a lot of details in there. Dr. Kelly had talked about being careful with data and what it says. So I really encourage folks to continue keeping up with the accurate sources of data, and we will make that available as we speak. I'm on texting with my public information officer earlier, and Dr. Kelly or Dr. Johnson, please address Commissioner Williams' question about the spike that she had mentioned.
And the accurate information and finding those sources is so important. So I would encourage the public to remember to look for them. Thanks.
So as far as the spike on Mondays, some of that may be due to just reporting, because oftentimes we are not necessarily reporting on Sundays. We're trying to give those folks at least a little break there. But yeah, we have seen days where we've had big jumps, and then we don't have jumps for a couple days. And so as we look through this, those will probably smooth out. Early on, like I said, there was the one jump, but that was because they had I think a 500 case backlog at CDPHE, or maybe even more than that, and they got all those tests out, and so suddenly it looked like, oh my God, we doubled in a day. Well, we didn't. They just did all the tests finally. But I think it's an important point that you make, that as we continue through this, like I said, this is a 12-round title fight, and the way we're going to win is by being consistent and measured, and and fight the plan. And this is what the plan is. And the second you deviate from the plan, that's when you get knocked out, right? And so we're going to continue to do that throughout, and that goes to people's activities, and always making those good decisions, no matter what day of the week it is, no matter what you got going on, because we all got stuff going on. But fight the plan, and we'll get through this thing.
Commissioner Bremer, do you have comments or questions for Dr. Kelly?
I just wanted to take the opportunity. You started your presentation, Dr. Kelly, saying that you were grateful for the foresight and setup that Director Wheelan has put in place at the health department. I am also grateful for your leadership on this, for your ability to step in and be a partner and bring your expertise and, quite frankly, your very concise and knowledgeable way of communicating to the public. You've said several times that we are asking a lot of our citizenry, and I think you're absolutely right. And I'm just very grateful that between your work, Dr. Johnson's work, and all of the epidemiological things going on, investigations going on, I am grateful that the things that we are asking of our citizenry are very data driven, and that we have compelling evidence for why we are asking what we're asking. And I just appreciate that you have been willing to pretty much be the face of that, because you come with a lot of credibility and a wonderful way of making it easy for everyone to understand why it's so important. So thank you very much.
Well, thank you. And as Jim Reed said earlier, we have the exact right people in the exact right places across the board, including Dr. Johnson, who is the medical director of public health. And she came from UC Health and an emergency medicine background. And honestly, without her connections and her experience and what she means to that side of this, we would not have accomplished a fraction of what we've done. And so across the board, every single person is exactly the person that we needed at this time. So thanks.
And before I get to the Vice Chair, Dr. Johnson, did you have any comments at all, or do you just want to take questions if they come up?
Thank you for the opportunity to speak. I have to commend not only what we've been able to accomplish from the government side, but also our private sector and nonprofit sector in the way that they've come together. We have had the opportunity to set the table, but everybody has been willing to bring their assets and collaboration. And it's not always easy, because this is a moving target, because a lot of our issues that we need to deal with are complicated even before you added COVID into it. But because of that willingness to collaborate, which was really established over the last decade, in my experience, as we've moved forward, we're seeing the fruit of that in really amazing ways. So to have the homeless isolation shelter opening today, and we'll knock on wood, I'm an ER doc, so we knock on wood when we say things to assure that we don't jinx it, but it should be moving forward, and that is a tremendous lift. And I look forward to the time that we can talk more about who all came together to make that happen. But it was certainly tenacity. We're looking at alternate care shelters, we're looking at long-term care steering committees, and all of these testing sites and different things are profoundly impacted by the willingness of individuals to work together. And to the point that's been made around data, because of our ability to set up our data analytics office, our private agencies can feed that data in, and it has been really helpful in getting a global view of what's happening in our community, not only locally with our epidemiologic studies, but getting that data from our hospitals and our private practitioners and some other places that help us to get a better pulse, even as we struggle with some of our resources with testing and other things. So, thank you.
Thank you. Mr. Vice Chair?
Thank you, Mr. Chair. So I just wanted to thank the Health Department for all the strong, great efforts you've been doing, the presentation as well, and OEM, they're doing a great job, and I wanted to thank you and the staff. I know they're tirelessly working on behalf of the citizens and residents. The health and safety of our residents is our priority, and so we want to continue to work. I've got to thank you again for all the collaboration of your office and the coming together of our community. Just in the last several days, I've fielded several calls from nonprofits and individuals who are volunteering space and resources to the health professionals in the medical community, and so we've gotten those in touch with the proper volunteer coordinator for the county. But it is amazing to see the great work you've been doing and the community coming together on behalf of everybody. So again, God bless and thank you for all these ongoing efforts.
Yes, Director Wheelan.
May I add just a little bit more? I wanted to end this session with a quote by Mr. Rogers, and look for the helpers. And I think that that's what you're speaking to, Commissioner Gonzalez, and what we've heard here today. The folks that you don't see here that are working so tirelessly behind the scenes, not only the epidemiologists and our public health staff, but the whole healthcare system, the nurses, the physicians, the doctors, everyone in the hospitals, regardless of what role they have, they are working tirelessly, and all of our first responders. And when I say look for the helpers, there are phenomenal community-minded people that have been stepping up and lifting up our community. That we are in this for the long haul, and I wanted to greatly emphasize that we all have a role to play, and we are working really hard, and it works better when everyone works together. And I just greatly appreciate the community efforts, and I am so proud to be part of El Paso County. So thank you.
Yeah, and I'll tell you, I'll echo that. As local elected leaders, we have a couple of simple responsibilities. Number one is protecting the public safety. That is a key fundamental role of government. It's something that we need to do and we need to take seriously. In some areas, that's a little easier to do than others. For law enforcement officers out there, they can stop speeders that are on the roads, and we know that that protects the public safety. They can, arrest the drunk drivers, and that protects the public safety. When we're dealing with a pandemic like this and somewhat of an invisible attacker on our society, that gets a lot more difficult to do. And so I think in this circumstance, early on for us, it was more difficult because we didn't have a lot of great data. We were just trying to make decisions based on what we thought was going to happen in the future. And I'll tell you, having people who have a good understanding of, even without data, what things are going to look like makes our job infinitely easier. And so I'm incredibly appreciative, number one, of the foresight early on with which you guys approached this whole pandemic, and how you approached those of us in government making decisions impacting the way things were going to happen moving forward. I think that was huge for us to be able to flatten that curve a little bit. But now I think it's great as the public settles into this new normal. I think we can all appreciate frustrations that are starting to set in, because none of us like being home for endless hours at a time. We enjoy going out to dinner with our families, and we enjoy socializing and recreating with our friends and other family members and folks that we can't do that with right now. But I think having this kind of data, putting together such an extensive presentation on this, helps us understand why we need to endure that frustration for the foreseeable future, to make sure that we are doing everything we can to prevent the spread of this moving forward. And so I think this is something that I hope not just every citizen of El Paso County gets to see, but every citizen of the state of Colorado and every citizen of the United States of America gets to see presentations like this, to really show show what it is we're up against here and how we need to approach it moving forward. So, yeah, certainly, for the entire board, thank you so much for all you're doing in this process. It truly saves lives, and we appreciate that, and we are certainly here to serve in any capacity that we can to make sure that we're doing our part as well. Thank you for the presentation.